Series. Now this video is on estimation of blood glucose by glucose oxidase and peroxidase method. Coming to the principle behind this method, glucose in serum is oxidized by glucose oxidase to gluconic acid and hydrogen peroxide. Now the peroxidase enzyme splits hydrogen peroxide into water and nascent oxygen, and this nascent oxygen oxidizes colorless chromogen to a red colored product. The intensity of the red color is directly proportional to the concentration of glucose present in the serum sample, and this is estimated at 540 nanometer. Now what is the procedure? First, you need to take 3 test tubes and label it as blank, standard and test. Okay, to the test tube labeled blank, you need to pipette 20 microliter of distilled water. To the test tube labeled standard, you are required to pipette 20 microliter of glucose standard solution. And to the test tube labeled as test, you are pipetting 20 microliter of serum. Now how do you get serum? You are collecting around 2 ml of venous blood from median cuboidal vein, and this blood is centrifuged, and whatever the supernatant you collect is known as serum. Now there is a difference between serum and plasma. So when you collect the blood in a container that contains anticoagulant, and when you centrifuge it, you get plasma. If you are collecting the blood in red color coded vacutainer that does not contain any anticoagulant, and when you centrifuge that, you will get it serum. So here in the lab we are using serum sample, but actually for diagnostic purpose, venous plasma sample is preferred one. Okay, to all the 3 test tubes, you are adding 2 ml of GOD-POD reagent, glucose oxidase peroxidase reagent. So, and you are allowed to stand all the 3 test tubes at room temperature for a period of 10 minutes. Now, this 10 minutes is needed for the reaction to go for completion, where glucose will be oxidized by glucose oxidase to gluconic acid and hydrogen peroxide, and the peroxidase enzyme that is present in the reagent will split this hydrogen peroxide to water and nascent oxygen, and this nascent oxygen oxidizes colorless chromogen to red colored product. Okay, so then after 10 minutes, once the reaction goes for completion, you are taking the reading at 540 nanometer. Here are the images of the procedure for estimation of blood glucose. Here the candidate is pipetting serum into the test tube. Now this is the candidate is pipetting distilled water into the reaction tube. Now after 10 minutes of standalone time, when the reaction goes for completion, this is how the test tube, this is how the color looks like. Now here we are just showing only 2 test tubes. One is the blank and the other one is the test. So you can appreciate there is no color change in the blank, because blank contains only distilled water and the GOD-POD reagent, whereas now this is the test tube label T patient sample with 20 microliter of the patient serum sample and 2 ml of GOD-POD reagent. Now just appreciate this color. Now here is one more patient sample. Now just appreciate this color. So the intensity of the color in second sample is more than the intensity of the color in the first patient sample. The second patient sample, the blood glucose concentration is more when compared to the first sample. That is based on color, we can slightly differentiate now which patient is having more glucose. So in order to get the specific value, we have to subject this test tube reading to colorimeter or the spectrophotometer. So here we are here this is the colorimeter where we place the test tube, both the blank and the test, in the colorimeter and take the record the readings at 540 nanometer. Now how to do calculation? This is manual calculation if you are using colorimeter. So if you are using semi-auto analyzer, you will get the exact value. Now I am just explaining you the how to calculate the concentration of serum glucose manually. So based on Beer-Lambert's law, the calculation goes like this: optical density of test divided by optical density of standard into concentration of standard divided by volume of sample taken into 100, because we are stating all the biochemical parameters with respect to 100 milligram per deciliter. So now substitute all the values in the above formula. So optical density of test divided by optical density of standard. Now the concentration of standard is 0.02 here, and the volume of the sample taken is also 0.02 into 100. Now, usually in the university examination or the practical examination internals, this derivation is not asked in your interest, or sometimes it will be asked when you have answered all the questions correctly, not to award more marks or the distinction marks. This will be asked in the exam. Now, let's understand how did you get this factor of 0.02. Now, the glucose standard concentration is 100 milligram per deciliter. This will be mentioned in the kit insert. Okay. Now, so we know from this thing 100 ml contains 100 milligram per deciliter. So how this standard is prepared is for 100 milligram of glucose is dissolved in 100 ml of distilled water. Okay. So 100 ml of distilled water contains 100 milligram per deciliter of glucose standard. So 1 ml will contain 1 milligram per deciliter. So 1 milligram can be represented as 1000 microliter. Now 1000 microliter contains 1 milligram per deciliter. But here we are just using only 20 microliter. So 20 microliter contains how much of glucose? Now this will turn out to be 0.02 milligram per deciliter. Okay. So similar, because we are taking the volume of the sample also 20 microliter. So this represents 0.02 concentration. So substitute this and you get the factor. Both this get cancelled, and the factor for calculation is optical density of test. Now this you will get the OD value when you keep the test tube in the colorimeter. You record this value, and ODO standard also record, and multiply by this factor 100 milligram per deciliter. Then report the sample as the concentration of glucose present in the given serum sample is that many milligram per liter. Okay, so what are the other methods of estimation of blood glucose? Now this was enzymatic method, and the enzyme used are glucose oxidase and peroxidase. Which are the other methods of estimation? This is the most common practical question asked in your university examination or in the internals. So the other enzymatic method is hexokinase method. There are so many other manual methods like orthotolidine method, Nelson-Somogyi method, Foligno method, King and Assatur methods. Now these are no longer used because they are time consuming, and so much of interference is there with other carbohydrates and non-carbohydrate reducing substances also interfere with this method. Okay. Now, so this is coming to the interpretation part. Now how to interpret the blood glucose. So fasting plasma glucose. Now we need to differentiate these glucose values between healthy adults and diabetic and the pre-diabetic individuals. Now let's first consider the fasting plasma glucose. If the glucose and fasting state is defined as there should not be any calorie intake for a minimum period of 8 hours duration and maximum of 12 hours duration. So if the patient is a healthy adult, the fasting plasma glucose values lies between 70 to 99 milligram per deciliter. If the value is more than 126 milligram per deciliter, then we can make a lab diagnosis of diabetes mellitus. If the value lies between 100 and 125 milligram per deciliter, then it is the state of impaired glucose tolerance or pre-diabetic condition. Coming to 2-hour plasma glucose. Now WHO states that after the fasting sample collection, patient should be given 75 gram of anhydrous glucose dissolved in clean water, and patient is allowed to drink it orally. Then 2 hours later, blood glucose is again estimated by GOD-POD method. So if the blood glucose is less than 140 milligram per deciliter, then the person is considered to be a healthy or a normal individual. If the value is more than 200 milligram per deciliter, then diagnosis of diabetes mellitus is made. If the value lies between 140 and 199 milligram per deciliter, it indicates a state of pre-diabetes or impaired glucose tolerance. Now there is a difference between 2-hour plasma glucose and post-prandial plasma glucose. Now for routine investigation purpose, the prandial glucose, post-prandial glucose is used, but for diagnosis of diabetes we have to use the 2-hour plasma glucose as stated by WHO by giving 75 gram of anhydrous glucose dissolved in water. The other terminology is post-prandial blood glucose or the plasma glucose. Now what is this? So here, after the patient gives the fasting sample, patient is sent back to his home, allowed to have regular breakfast, whatever he or she regularly consumes, then 2 hours later he or she has to come back to lab to give the sample for blood glucose or the plasma glucose estimation. So that is prandial, and this is different. 2-hour plasma glucose, that is how it differs from post prandial plasma glucose. Now the third parameter is the random blood glucose. Random means any time of the day, regardless of the relation to the meal, the blood glucose is collected. If the blood glucose value is less than 140 milligram per deciliter, the person is considered to be healthy, and if it is more than 200 milligram per deciliter along with classical symptoms of hyperglycemia like polyuria, increased urination, polydipsia, increased thirst, unexplained weight loss, or if the patient is presenting to the hospital for the first time with hyperglycemic crisis, that is a very highly increased blood glucose along with ketoacidosis, then diagnosis of diabetes mellitus is made. Okay, the last component is hemoglobin A1C. Now what is this hemoglobin A1C? So normally what happens, this glucose gets attached to N-terminal end of hemoglobin. Okay, now in healthy adults it is and this hemoglobin A1C is expressed as percentage. If it lies below 5.7%, the person is considered to be healthy. If the value is more than 6.5% or equal to 6.5%, then diagnosis of diabetes mellitus is made. If the value lies between 5.7 and 6.4, then the diagnosis of pre-diabetic condition or impaired glucose tolerance is made. This is how you need to interpret the blood glucose values depending upon their fasting state, postprandial state, or 2-hour plasma glucose, and the random blood glucose. Now, so there is one more terminology called gestational diabetes mellitus, and what values are used for diagnosing of this gestational diabetes mellitus. Now, this gestational diabetes mellitus is the onset of hyperglycemia or observation of hyperglycemia seen in a pregnant lady after 24 to 28 between 24 to 28 week of gestation. Now, so I am just presenting the Indian guidelines for diagnosing of gestational diabetes mellitus. Here they use single non-fasting sample, and they give a glucose load of 75 gram of glucose, and 2 hours later the plasma glucose is estimated using GOD-POD method. If the value is more than or equal to 140 milligram per deciliter, then diagnosis of gestational diabetes mellitus is. Coming to the clinical significance part, let's first understand hyperglycemia. Hyperglycemia means increased blood glucose, fasting more than 126 and postprandial more than 200. What are the causes? Now immediately after food, the blood glucose increases because of release of glucose into the bloodstream. So as you all know, you have the carbohydrate rich diet which is ultimately broken down to glucose, and this glucose is released into bloodstream. So this will cause postprandial hyperglycemia. Then the most common cause is diabetes mellitus, either due to deficiency of insulin as in type 1 or insulin resistance as in type 2, where glucose remains in circulation because of insulin resistance or deficiency of insulin. Glucose is not taken up by the adipose tissue cells and the muscles. The next condition is thyrotoxicosis or hyperthyroidism. So now here it is characterized by increased synthesis and release of thyroid hormones. Now these thyroid hormones are hyperglycemic in nature because they stimulate gluconeogenesis pathway, where glucose is synthesized from non-carbohydrate source, and they also stimulate glycogenolysis, where glycogen is broken down to glucose. That is how, so in hyperthyroidism and thyrotoxicosis you get to see increased blood glucose. The next condition is hyperpitutarism, characterized by increased growth hormone and increased ACTH. Increased growth hormone decreases glycolysis. It will inhibit glycolysis, so glucose is not oxidized. So that is how it increases blood glucose. The other factor in hyperpituitarism is increased synthesis and secretion of adrenocorticotropic hormone, and this will stimulate gluconeogenesis, synthesis of glucose from non-carbohydrate source. That is how in hyperpituitarism the blood glucose increases. The next condition is Cushing syndrome, characterized by increased cortisol. Now this increased cortisol stimulates gluconeogenesis, synthesis of glucose from non-carbohydrate sources. That is how it contributes to hyperglycemia. The next condition is pancreatitis or carcinoma of pancreas. Here there is damage there occurs damage to beta cells of pancreas, and as you all know, beta cells of pancreas secrete insulin. So decreased insulin, decreased glucose uptake by muscle and the adipose tissue, blood glucose increases. So the next condition where you get to see hyperglycemia is as a metabolic response to sepsis and infectious disease. Now both the conditions are characterized by acute stress response, which increases the counter-regulatory hormones, mainly the cortisol and epinephrine. And both of this, the cortisol stimulates gluconeogenesis and epinephrine stimulates glycogenolysis. That is how the blood glucose increases in sepsis and infectious disease. The last one is the gestational diabetes mellitus. Here hyperglycemia observed after 24 weeks and between 24 to 28 weeks of gestation. Now this is because of release of placental hormones like human placental lactogen, estrogen, cortisol, and all of this block insulin action, and that is how the blood glucose increases. Now conditions where you get to see hypoglycemia, and hypoglycemia means the blood glucose is less than 70 milligram per deciliter. Now what are the conditions where you get to see hypoglycemia? One is overdosage of insulin or overdosage of anti-diabetic drugs like oral hypoglycemic drugs. So what happens? Increased insulin, increased uptake of glucose by the cells where glycolysis operates, and there is no glucose, sufficient amount of glucose in the circulation, and it manifests as hypoglycemia. Next is severe starvation. Patient is not eating anything orally, so there is less blood glucose resulting in hypoglycemia. Next condition is insulin secreting tumors of pancreas. So more insulin, more glucose uptake and less glucose in the circulation. Hypothyroidism characterized by decreased synthesis and secretion of thyroid hormones T3 and T4. So what happens is decreased stimulation of gluconeogenesis and glycogenolysis. That is how blood glucose decreases. Addison's disease decreased characterized by decreased cortisol. So decreased gluconeogenesis, decreased blood glucose. Hypopituitarism characterized by decreased growth hormone. So increased glycolysis, increased glucose uptake and decreased blood glucose. Low adrenocorticotropic hormone. So decreased stimulation of gluconeogenesis. That is how the blood glucose decreases. Next is VonGierk's disease. This is a glycogen storage disorder characterized by deficiency of glucose 6-phosphatase enzyme. So here this impairs glycogenolysis, where glycogen is initially broken down to glucose 6-phosphate, and this glucose 6-phosphate is broken down by glucose 6-phosphatase enzyme to glucose. Now this is not taking place, so decreased blood glucose, and that is how hypoglycemia manifests in VonGierk's disease. Now what are the different levels or severity of the hypoglycemia? Level 1 or the mild hypoglycemia is characterized by blood glucose less than 70 milligram per deciliter but more than 54 milligram per deciliter. Level 2 moderate hypoglycemia is characterized by blood glucose less than 54 milligram per deciliter. So level 3 or severe hyperglycemia is the glucose level can be anywhere between 54 less, it can be less than 54 also and less than 70, but the characteristic feature is there is altered physical and mental status requiring treatment of hypoglycemia. So this was all about the clinical significance of estimation of blood glucose. Yeah, so please do like, share and subscribe. Thank you for listening, and please do watch this video where in detail explanation is given on how to identify the presence of sugar in urine. So this is the link to the your abnormal urine analysis for mainly reducing sugar and ketone bodies. Thank you.